So we'll finish up this week with discussion of the venous system, the lymphatic system, and then the changes that happen right at delivery to alter the process, the pattern of the circulatory system to allow for breathing air, so that we're shifting where it is that oxygenated blood comes from. So the venous system. The development of the venous system in detail, the process of creating veins, building the venous system is really quite similar to the process for the arterial system. Vasculogenesis, angiogenesis, all of that also happens for the venous system. So we aren't going to go through it all again. But I am going to highlight some divisions of the venous system. There is the vitelline system. So again, these are the yolk sac derivatives. Okay. So just like vessels or arteries from the yolk sac become functional parts of the baby's circulatory system, so do the veins. Okay. They drain the gastrointestinal tract and the gut derivatives, just like the vitelline arteries provide blood to the gastrointestinal tract and the gut derivatives. And so some of the veins of the vitelline system include the liver sinusoids, which are essentially just sort of anastomosing or merging capillaries that allow for gas exchange, the lower section of the inferior vena cava, the ductus venosus. There are lots of other ones. These are sort of the heavy hitters for that system. Then there's the umbilical system. So the umbilical system is essentially the blood that's flowing in from the placenta. So the vessels that are going through the umbilical cord and into the baby. Now, they're bringing in oxygenated blood, but they're veins because they're flowing towards the heart. Okay, and that's why they're covered here. So the left umbilical vein is going to persist and anastomose with the ductus venosus. Okay, and we'll talk a little bit about that, but this is another one of those shunts that allows for proper circulation of oxygenated blood during fetal life. Finally, there's the cardinal system. This drains the head, neck, and body wall. So these are the veins flowing from the head, neck, and body wall into the heart. And that would include the superior vena cava, the cardinal veins, which drain the head and the neck, and then the right and left limb butts are also part of that system. Oh, and I've missed my boxes again. Okay, the lymphatic system is also a venous system derivative. So your lymphatic system, for anyone who hasn't spent a lot of time thinking about it, is really all about fluid balance. This is a system of interconnected sacs and vessels that all contain fluid that help with regulating homeostasis in humans. It also is sort of a passageway for immune cells, and actually the lymph nodes themselves can become staging grounds for an immune response. You can get a buildup of immune cells in a lymph node when you're preparing to fight something, which is why if you've ever been to the doctor with a cold or an infection of some kind, you might feel around under your chin for the lymph nodes that are located there. If they're swollen, that can be a sign of infection. Also, lymphatic system has a role in transporting fats and nutrients from the digestive tract, so they do a little bit of that as well. But it's derived from sprouts of the cardinal veins, from the cardinal venous system, and that's why we highlight it here. We aren't going to spend a lot of time on the lymph system. Okay, so, and this is a short lecture, so prepare yourselves here, but this is key. So the changes to vasculature between fetal life and after birth. And I'm not sure why the fetus is happy and the afterbirth baby looks angry. I don't think that's a comment on whether or not one or the other is better. But at any rate, during fetal life, okay, oxygenated blood flows in through the umbilical vein. Okay, so that's shown here. The oxygenated blood is flowing in through the umbilical vein. Again, it's a vein because it's flowing towards the heart. Okay, there are two shunts that move oxygenated blood from the umbilical cord to the fetal tissues. Okay, and they're in two different places. There's the ductus venosus. Okay, and the ductus arteriosus. Both of these are involved in getting oxygenated blood to the tissues. Okay. In a system that's really designed for all the oxygenated blood to come from the heart. Also, there's the foramen ovale, which we talked about in earlier lectures, that gets oxygenated blood from the right atrium to the left atrium, and it's the left atrium that then pumps blood into the left ventricle, and it's the left ventricle that pumps blood out through the aorta to the body. Okay, And in the fetal system, you're going to see some mixing of oxygenated and deoxygenated blood. Okay? It's not a perfect system. There is some inefficiency there, but it works in a way that it wouldn't work without these shunts in place. At first breath, so immediately, as soon as the baby takes that first breath, you see a tremendous change in blood pressure, in the pressurization of the system. And it's that change in pressure that produces these changes in structure. Okay? So when the baby first breathes, that inhalation expands the vessels of the lungs, allowing blood to flow into the lungs. So before, the lungs were fairly compact and collapsed, and blood couldn't get into them. Okay? Or it could, but not to the degree that it can once the baby starts breathing. Likewise, once the umbilical cord is clamped or cut, it essentially prevents blood flow from coming from the placenta. So we have this tremendous change in the pressurization of the system. One source of blood pumping in is gone. We also now have a whole region of the body, the lungs, where blood can flow more freely. So that causes constriction of the ductus venosus and the ductus arteriosus and closes the foramen ovale. So the ductus venosus and the ductus arteriosus become constricted to the point that they essentially disappear. Foramen ovale closes, and we're left with a system that is ready to function in the way that the baby needs it to.